In this module, we will discuss how to give local anesthesia and how to get teeth numb on an expedition. And in the first part of this, we will discuss what instruments ideally we would need to do this on an expedition. So we will discuss a dental syringe and dental cartridge. So a dental syringe obviously consists of a needle, the syringe and the cartridge. The needle itself, one has to open it. So how do you open it? So you twist and you pull. Now this dental syringe has got two components. It's got the short needle bit which goes into the barrel of the syringe and the long needle bit which goes into the patient's mouth. So we open the short needle bit by a twist and pull, then we push the end of the needle into the barrel of the syringe and we screw it in finger tight. Now we have to open the barrel of the syringe. To do this, we pull the plunger all the way back. So as we pull the plunger all the way back, the plunger pulls away. Now here it is in the barrel of the syringe and it pulls away from the barrel of the syringe, unlocking the barrel of the syringe. And then the barrel flips open like a shotgun and then you slide your cartridge in. You slide your cartridge in metal end first, straight down the barrel of the syringe, and then you flip it back close. Let us summarize this with a video. So we take our syringe, we pull our plunger all the way back. As we pull it back, it unlocks from the barrel of the syringe, allowing you to flip the barrel of the syringe open like so. Then we take our dental cartridge. We slide it in metal end in first and then we flip it back shut. Now it's ready to use. So see, it's all in the barrel. Yeah. Now what are the different techniques of local anesthesia? There are three different techniques of local anesthesia. The first is a technique of infiltration. In the technique of infiltration, we essentially flood the area around the tooth with local anesthesia. So we flood the area outside with local anesthesia and we flood the area inside with local anesthesia. So we are sandwiching the tooth between two floods of local anesthesia. This will work where the bone is soft. So therefore, it will work on all the top teeth, but it will work on only the first four bottom teeth on the left hand side and first four bottom teeth on the right hand side. Why will it not work from the 5th to the 8th tooth on the lower left hand side and 5th to the 8th tooth on the lower right hand side is because the bone around these teeth is too dense and too compact. So therefore, not enough local anesthesia will go through the gums, through the bone and reach the tooth in sufficient amount to get it numb. So to numb these teeth, that means the 5th to the 8th tooth on the lower left and 5th to the 8th tooth on the lower right, we have to give a mandibular nerve block. Now when we give a mandibular nerve block, it anesthetizes all the teeth from number 1 to number 8 on the lower right hand side and number 1 to number 8 on the lower left hand side. There is a third technique of anesthesia also, which is known as intraligamentary technique. This is where we push the local anesthesia in the tight confines between the root and the bone. It is an additive technique of local anesthesia. So basically you try infiltration or nerve block, and if it does not work, you tried it twice, This is another one you add on to it. So you locally infiltrate around the tooth. So it is an additive form of anesthesia, further reinforcing your local anesthesia if the anesthesia is not working very well. So what are the different methods of infiltration? So in the infiltration, let us first deal with the upper buccal infiltration. In the case of an upper buccal infiltration, we pinch the top lip between our thumb and our index finger, and we give a nice deep pinch. So the finger outside the mouth goes a good distance outside the mouth, the finger inside the mouth goes a good distance inside the mouth, thereby you grab a good thick wad of lip tissue or soft tissue, and then you pull it upwards and backwards. As you pull it upwards and backwards, it forms a traction plane. Now where this traction plane meets the bone on top of the tooth you want to get numb, that is where you're going to push your needle in. If you want to get this tooth numb, you give your injection here. If you want to get this tooth numb, you give your injection here, this tooth numb here, this tooth numb here, this tooth numb here. Okay. Now why is this landmark such a good landmark? Because this landmark takes you to that part of the soft tissue which lies closest to the apex of the root. You can see it's quite high here, and that lies closest to the apex of the root where all the nerves are entering into the tooth. Okay. Now how deep should you push your needle in? You push your needle in till it hits the bone, because these injections are paraperiosteal injections. How much do you inject? You inject half a cartridge of local anesthesia, which is approximately around 1 millimeter of local anesthesia. Okay. Do you need to aspirate? No, you do not need to aspirate for these patients because there is no big blood vessels in that area. At what angle will you push your needle into the soft tissues all the way down to the bone to give you a paraperiosteal injection? You put your needle in at an angle of 20 to 40 degrees. Why do we use that angle? That is because if you push your needle in at 90 degrees, the tip of the needle will not bite sufficiently into the soft tissues to hold the local anesthesia. That is why we have to push it in at a slight angle so it bites sufficiently into the soft tissues before it hits the bone to allow you to give the paraperiosteal injection, and you give approximately half a cartridge of local anesthesia. Okay. As I said, you do not have to aspirate in that area. There is no big blood vessels situated in that area. Let us summarize this with a video. So we are pushing the needle in at an angle of 20 to 40 degrees. We grab the lip, pull the lip upwards and outwards, getting a traction plane. Where this traction plane meets the bone at the top of the tooth you want to get numb, that is why you push your needle in till it hits the bone, and you inject approximately half a cartridge of local anesthesia in that area. And then you half a cartridge of local anesthesia in that area, like so. Next, so we've injected the outer part of the tooth, which is we given an upper buccal infiltration. Now you have to give the palatal infiltration, because you have to sandwich the tooth between two floods of local anesthesia. So we injected the outside surface of the tooth or the buccal aspect of the tooth with local anesthesia. Now you have to flood the inside of the tooth or the palatal surface of the tooth with local anesthesia. Now where do you give it on the palatal surface of the tooth? You give it on the softest area, the relatively softest area of the hard palate. Now this is the area of the gum tissues which is closest to the tooth, which is very hard. This is the gum area which is in the center of the palate, which is very hard. The relatively softest area is the area in between these two zones. It is approximately 5 to 10 millimeters from the gum margin. At what angle will you push your needle in? You'll push your needle in, so you will go from the opposite side of the mouth, push your needle in at an angle of 45 degrees. So this is your needle going in, it is at an angle of 45 degrees. You push it in till it hits the bone. This is a paraperiosteal injection. So therefore, if you want to get this tooth numb, it's here. 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 Do you need to aspirate? No, there are no big blood vessels in this area, so there is no need to aspirate. And how much local anesthesia will you give in this area? Approximately half a cartridge of local anesthesia, which is around 1 millimeter of local anesthesia. And we are summarizing this with a video going from the opposite side at an angle of 45 degrees to the relatively softest area of the palate, which is 5 to 10 millimeters from the gum margin. We don't need to aspirate, and we inject approximately half a cartridge of local anesthesia. So now let us look at the infiltration techniques for the lower teeth. The lower teeth infiltration will start with the lower buccal infiltration, which is very similar to the upper buccal infiltration. So we take our thumb and index finger and we pinch the lower lip. Give a nice deep pinch to the lower lip and we pull the lower lip downwards and forwards. So as we pull the lower lip downwards and forwards, we are forming a traction plane. Where this traction plane meets the bone at the bottom of the teeth you want to get numb, that is where you're going to push your needle in. So if you want to get this tooth numb, it's here, this tooth numb, it's here, this tooth numb, it's here. And you will notice that it is quite low down. So this is the traction plane. It's meeting the bone here. So if I want to get this tooth numb, this is the traction plane meeting the bone at the bottom of this tooth. I'll push my needle in there. And you will notice it's quite low. It's low because that landmark places the needle closest to your root apex, and that is where all your nerves are entering the tooth. So that is why it is such a good landmark. You may also look at this place where you can see it's a nice thick wad of soft tissue which you grasp, so you can pull it down nicely and establish a good traction plane. Now, how deep will you go till you hit the bone? It is a paraperiosteal injection. How much will you inject? Approximately 1 millimeter of local anesthesia or half a cartridge of local anesthesia. And now when you see what angle will you push your needle in, again the angle is approximately 20 to 40 degrees. So it's either 20 to 40 degrees this way, 20 to 40 degrees this way, 20 to 40 degrees this way, or 20 to 40 degrees this way. It is always at an angle of 20 to 40 degrees. Why? Is because if we push the needle in straight in at 90 degrees, it will not bite sufficiently into the soft tissues to hold the local anesthesia. So now we've injected the outer surface of the tooth with local anesthesia. We have to flood the inside of the tooth with local anesthesia, thereby sandwiching the tooth between two floods of local anesthesia, one flood on the cheek side and one flood on the tongue side. So as I said, there is no need to aspirate in this area when you give this injection. And let us summarize the lower buccal infiltration with this brief video. As you're pushing the needle in at an angle of 20 to 40 degrees, where the traction plane meets the bone at the bottom of this tooth, which you want to get numb. Now, when you give the buccal infiltrations, you have to remember that it will essentially numb this tooth below which you're giving the infiltration, but to a certain extent, it also numbs the tooth in front and on the tooth behind. This applies for the upper as well as the lower. Okay, so now, as I said, we flooded the outside of the tooth. Let us see how we flood the inside of the tooth. So we grasp the tongue, we pull the tongue out of the way, and then we expose the gum area on the tongue surface of the tooth. and we select which tooth we want to get numb. For example, if I want to get this tooth numb, I just take my needle and insert it into the area of the gums closest to the tooth which you want to get numb, and inject approximately half a cartridge of local anesthesia till I get a blanching or a ballooning sensation or appearance in that area. Again, do we need to aspirate in that area? No, we do not need to aspirate for this particular injection. Let us summarize with a video. Now I want to get this tooth numb. You see, I push my needle in and you'll see the ballooning sensation developing in that area. Okay. Let us discuss about mandibular nerve blocks. So essentially you want to get the teeth from 5th to the 8th numb, and the bone is too dense, so hence I have to give a mandibular nerve block. So we will be discussing essentially the right-sided mandibular nerve block. For the right-sided mandibular nerve block, you stand on the right-hand side of your patient. Now we take our left hand, and the index finger of our left hand goes outside the mouth and rests on the posterior border of the ramus of the mandible. The thumb of our left hand goes inside the mouth, and then where does it rest? We will discuss that shortly. Okay, so we take an index finger, the index finger goes outside the mouth and it rests on the posterior border. You see this blue line on the posterior border of the ramus of the mandible. The thumb is going inside the mouth, and the thumb rests on the bony ridge on the cheek side of the bottom back teeth. Now, which part of the thumb we use? We don't use the bulbous part of the thumb, side of the thumb, top of the thumb. We use the tip of the thumb. So the tip of the thumb rests on the bony ridge on the cheek side of the bottom last teeth. You see this place called start? We put our tip of the thumb there and we follow this bony ridge backwards. As we follow this bony ridge backwards in the direction of those arrows, see, we started here and we are following this bony ridge which is on the extreme cheek side of the mandible. We follow it backwards. Now as it turns upwards towards the head, as it turns upwards, now it's on the horizontal, it's going to go to the vertical position. As it goes from the horizontal to the vertical position, what happens is that it drops into this little depression. It's not like the Grand Canyon. It's just a little depression as it goes from horizontal to vertical. What we do is we place the tip of the thumb in this depression, with the center part of the tip of our thumb will coincide with the center part of this depression. And this is your horizontal plane. So therefore, when you give a nerve block, it is like target practice. So you have a horizontal line and a vertical line. We locate the intersection between the horizontal and the vertical, and that intersection point is where we are going to push our needle in. So now we found the horizontal line. This is the horizontal plane, and when you look on the tongue side of the mandible, you will notice that this horizontal plane approximately coincides with this black dot. Now this black dot is this mandibular foramen. This mandibular foramen is where all the nerves are entering the bone to supply the lower teeth, and that is where we want to push our needle to. So we found the horizontal landmark or the horizontal plane. Now we have to find the vertical plane to give the or to locate the intersection. Okay. So how do we locate the vertical plane? The first thing we do is we find this muscular pillar which is going from the bottom teeth to the top teeth. Once we find this muscular pillar, which is known as pterygomandibular raphe, on the cheek side of this muscular pillar, so this is the muscular pillar, on the cheek side of this muscular pillar, there is a valley. That valley itself is your vertical landmark. Your vertical line or your vertical plane is this valley itself. So let us give you a bit of orientation. So this is the muscular pillar and it lies on the tongue side of the mandible. The valley which lies on the cheek side of this muscular pillar is still on the tongue side of the mandible. So this is the vertical bony ridge of the mandible and this valley is on the tongue side of the mandible. It is not on the cheek side, it's on the tongue side of the mandible. Okay, so let us look what this valley looks like. So in some people it's very, very prominent. In some people it's just a little fold. In some people it's a little crevasse. So the wider the patient opens the mouth, the easier it is to locate this valley and your vertical landmark. Okay, so now that you found this vertical landmark, where exactly in this vertical landmark are you going to give your injection? Are you going to push the needle in at the bottom, middle or top? You will push your needle in at the point of intersection from the horizontal line which you found with your thumb, which intersects with the vertical line which is your valley. So you'll push your needle in there. At what angle will you push your needle in? You will go from the opposite side of the mouth. So you will count your teeth from the opposite side of the mouth. So you'll count the fourth tooth from the opposite side. So you'll go 1, 2, 3, 4. You found your fourth tooth. So you take your syringe from the fourth tooth from the opposite side. You'll go across. You'll find the point of intersection and you will push it in till you hit the bone. Okay. How much will you inject here? It'll be 2 millimeters or a full cartridge of local anesthesia. Will you need to aspirate in that area? Yes, because there are some big blood vessels in this area. But because it is so difficult to aspirate with a dental cartridge syringe, we suggest that you inject your local anesthesia over a period of 1 full minute. So you inject it very, very slowly. Okay. Now I said it must go in till it hits the bone. How deep is that? That is 20 to 25 millimeters. So your needle will go through the soft tissues for 20 to 25 millimeters before it hits the bone. So let us summarize this. Okay. So like target practice, we have to have a horizontal line and a vertical line, right? So let's first find the horizontal landmark. Index finger goes outside, thumb goes inside, thumb goes onto the bony ridge, onto the cheek side of the bottom last teeth, follows it backwards. As it turns up towards the head, it drops into a little depression, which is known as the coronoid notch. You will use your tip of the thumb. You place your tip of the thumb in this depression known as a coronoid notch. The center part of your thumb coincides with the center part of the depression and gives you this horizontal plane. Next, you have to locate the vertical plane, and the vertical plane is this valley which lies on the cheek side of this muscular pillar but on the tongue side of the ramus of the mandible. So it's here. We will find the valley. We will tell our patient to open their mouth really wide so we can see this valley clearly. We will find the point of intersection of a horizontal line with a vertical line. We will count the fourth tooth from the opposite side. We'll push it in. Our needle will go at the point of intersection till it hits the bone, and that will be at a depth of 20 to 25 millimeters. And we will inject it very slowly over a period of 1 minute. Okay, let us summarize this with a video. That is the black dot where all the nerves are entering the mandible, which is known as the mandibular foramen. This is your coronoid notch or your little concavity. Okay, so we take our thumb, we put it into the patient's mouth, and we locate the coronoid notch as the bony ridge goes from horizontal to vertical. This is a vertical plane or the valley or the vertical line. So horizontal crosses vertical here. Take the fourth tooth from the opposite side. I go through to the point of intersection till I hit the bone. And then I aspirate if I can and inject it over a period of 1 minute, as dental syringes are not very good at aspirating. So that is how you give a mandibular nerve block. Now you have to anesthetize 2 more nerves to completely block that half of the mandible. And the one is the lingual nerve, which is blocked by default, just following the same landmarks. You don't have to follow any additional landmarks. You follow the same landmarks and blocks the lingual nerve. The other nerve to block is your buccal nerve. How do we do that? Essentially, we do the same as we did when we tried to find the horizontal landmark of your mandibular nerve block. So we take our thumb, we go onto the bony ridge, onto the cheek side of the bottom last teeth, we follow it upwards. As we follow it upwards and it drops into a little depression, which is known as a coronoid notch, if we inject our local anesthesia in that soft tissues, in that area, that will numb the buccal nerve. And then you would have numbed the lingual nerve, mandibular nerve, buccal nerve, essentially numbing the half of the mandible from the first tooth to the back tooth, and you can do then whatever procedure you want to do. Let us summarize the long buccal nerve block with this video. I've taken my thumb, pushed the thumb backwards, found the little depression on the bony ridge, which is your coronoid notch, and all I'm doing is I'm injecting in the soft tissues in that area to get the long buccal nerve block. Now there are some problem solving tips for expeditions. Essentially, if you've taken your needle in for a mandibular nerve block, so this is the place which you want to go, and it has to be at the depth of 20 to 25 millimeters. So going from the 4th tooth from the opposite side, push my needle in, the needle has hardly gone 2 to 3 millimeters and bang, it hits the bone. So obviously it's gone too short a distance. And the reason being the angle is too wide. So instead of pushing the needle in from the 4th tooth from the opposite side, I will withdraw the needle, take my barrel more anteriorly. So instead of the 4th tooth from the opposite side, I'll go behind the 3rd tooth from the opposite side. So I decrease the angle of pushing the needle in by taking the barrel a bit more forwards, and then I push it in and it reaches the correct location. I've got another problem. I push the needle in and it doesn't hit the bone, push the needle in and it doesn't hit the bone, pushed it to the depth of 30 millimeters, it's not hitting the bone. Obviously my angle is too little. So instead of going from the 4th tooth from the opposite side, I will withdraw the needle, take my barrel posteriorly, probably in front of the 5th tooth of the opposite side, increasing the angle, and then I push my needle in, and then it reaches this area to get those teeth numb because I've increased the angle to get to the correct location. Because the anatomical landmarks I gave you previously only sort of fit 50 to 60% of a Caucasian population, and thereby you have to adapt if you feel that the angle is too little or too much, like I said so. So what happens if you're given a mandibular nerve block or an infiltration? You're given it once, you're given it twice, and the patient still feels pain. Can you give another local anesthesia to top things up, an additive technique? Yes. So that is known as a periodontal ligament injection. So basically you take your needle in, you push your needle in the space between the tooth and the bone. In this tight space, you're pushing it in. As you push it in, you make sure your bevel of the needle is facing the tooth. And then you need certain degree of force to push the local anesthesia in, into this tight confines of the space. So this is an additive form of local anesthesia, just to top it up to get enough pain relief. What happens if you're on an expedition and you don't have a dental syringe or you don't have a cartridge? What can you do? What if you look through your medical kit and you find that you have 10 ml or 1% lignocaine? Now, lignocaine is a vasodilator. Ideally, we have to combine it with a vasoconstrictor so that it can stay long enough in local anesthesia, long enough in the mouth to give you sufficient depth of local anesthesia, as well as it'll control any bleeding following dental procedures. So we want to combine this with 10 ml of 1% lignocaine, we need to combine it with 50 micrograms of adrenaline to give you 1 in 200,000 mix. Now, how do we do that? If we rummage through our medical kit and we find that we have a 1 ml anaphylaxis ampule, then if we do 0.05 ml of this, because it is 1 in 1000 adrenaline, and we combine in 10 ml of 1% lignocaine, that would give us the correct concentration. What if we don't have a 1 ml anaphylaxis ampule? What we do have is a 10 ml arrest dose ampule, but that has 1 in 10,000 adrenaline. So if we take 0.5 ml of that and combine it with 10 ml of 1% lignocaine, that would give us the required concentration. What if we don't have a dental syringe? We have to use a normal syringe. So orange needle will not work. What we can try is first giving 23 gauge blue needle. We'll give 2 ml of this mixture using a 23 gauge blue needle. If it does not work, then we can try again giving another 2 ml with 21 gauge green needle. Because we would have already given 2 ml with the blue needle, when we follow it up with a bigger, thicker green needle, that will hurt less because the area around that area would be rather numb. So the patient will not feel that much when you're pushing a wider needle into that soft tissues. Now, what is the maximum dose, a safe maximum dose of local anesthesia? We think it's 6 cartridges is relatively safe, which is 12 ml, which is 300 milligrams per session for this patient. We have been asked this question often. What if we don't have local anesthesia or don't want to give local anesthesia? Can we use EMLA cream? Now, we know this is a combination of lidocaine and prilocaine. We also know that EMLA is not licensed to be used in the oral mucosa. However, there are a fair few studies where this has been successfully used. And we know that though the absorption through the mucosa is far greater than when applied to skin, it is still much lower than the toxic dose. So we suggest you dry that area. You can, if you want to, dry that area, put the EMLA cream, cover it with the gauze, let it remain for 20 to 30 minutes. You must appreciate that it will be difficult to get as effective analgesia with this as you do with local anesthesia. With local anesthesia, we also get vasoconstriction. However, in this case, we will not get that vasoconstriction. So therefore, after you extract the teeth, there could be a fair degree of bleeding. You may consider this technique if you are desperate, if you do not have local anesthesia, no option of Medivac, and if you are in a tight situation and there is a mobile tooth and there is no definite dental local anesthesia, then you may contemplate this technique. In our next session, we will discuss how to do a deep sedative temporary dental filling. Thank you.